हेलो फ्रेंड्स, वेलकम बैक टू आयुर्वेद परीक्षा ज्ञान। आज के वीडियो लेक्चर में मैं स्टार्ट करने जा रही हूँ मॉडर्न 500 मोस्ट रिपीटेड क्वेश्चंस। जब भी आप आयुर्वेद का क्वेश्चन बैंक देखते हैं प्रीवियस 10 ईयर्स के, चाहे गोविंद पारिक बुक में या प्रवीण चौधरी में, तो आपको यही मॉडर्न के क्वेश्चन रिपीटेड देखे गए हैं। क्वेश्चन नंबर 1, विच टाइप ऑफ सेल आर रिस्पॉन्सिबल फॉर सेल मीडिएटेड इम्यूनिटी? द आंसर इज T lymphocytes. Next, blood supply in tonsils occurs through which artery? That is lingual artery. Dual blood supply is present to which organ of the body? That is liver. Maximum conduction occurs at synapse. Blood flow not reduced during exercise to which part of the body? That is our brain. Aspirin was invented in the year 1899. Which type of lymphocytes are known as helper cells? That is T lymphocytes. Next, heat regulation center, medulla oblongata. Next, vomiting center, that is CTZ. Bile salts are derived from cholesterol. Next, in muscles, glucose is supplied in which form? That is glycogen. Action of theophylline, it is a bronchodilator. Indication of sulfasalazine, it is indicated in ulcerative colitis. Next is daily dose of diazepam, that is 5 to 10 milligram. Imipramine is used in IBS, it is irritable bowel syndrome. Next, what is the toxic effect of PCM? That is paracetamol, it causes blood dyscrasia. Next, bulk forming laxative, that is isabgol. Haloperidol is a antipsychotic drug. Next, IV dose are comparatively less than oral dose. It is a right statement, that is correct statement. Bromihexane acts as mucolytic. Next question, corrosive material, alum. Alum is a corrosive material. Anaphylactic reaction are mediated by IgE cells. Next, myxedema is a sign or disease which is seen in hypothyroidism. Next, Kussmaul respiration seen in metabolic acidosis. Next, multiple sclerosis occurs in CNS. Histamine is secreted during allergic reactions. Next, primary symptom of intestinal obstruction, it is vomiting and spasmodic pain. Next, pseudodiabetes seen in pancreatitis. Biliary stones are common in CPD, that is common bile duct. Which type of cells are devoid of phagocytosis? That is basophils. Next, not symptom of uremia, that is gastrointestinal bleeding. Pelvic diaphragm is formed by levator ani muscle. Next, spasmodic dysmenorrhea is seen between the age group of 15 to 35 years. Next question, amnion is formed by cytotrophoblast and ectodermal germ layers. Whooping cough, the incubation period of whooping cough is 7 to 21 days. Vector of Japanese encephalitis, it is fly. Next question is hyperventilation causes alkalosis. Next, azotonic uremia is seen in diabetes. Next, cancer of parathyroid gland associated with achinal cells. Next, which is the common type of abscess? It is perianal abscess. Next, in 6th month, the circumference of head of a baby is 17 inches. Next question, spinal cord, that the length of a spinal cord is 45 centimeter. Ossification centers of scapula, 8. Left gonal vein is a branch of left renal vein. Next question, foot drop syndrome occurs due to paralysis of common peroneal nerve. Next, refractive index of cornea is 1.37. SGOT and SGPT enzymes are increased during viral hepatitis. Next, sunset sign, it is a symptom of hydrocephalus, seen in hydrocephalus. Kidney substance responsible for utilization of calcium, it is calcirol. Next, Hager sign seen in pregnancy occurs during 6th to 10th week of pregnancy. Next, fat soluble vitamins, A, D, E, K, that is ADEK are fat soluble vitamin, and remaining, that is B and C, are water soluble. Next question, anti-sterility vitamin is vitamin E. Incubation period of yellow fever is 3 to 6 days. Megaloblastic anemia occurs due to deficiency of vitamin B12. Sterilization of milk occurs by Holter's method. Bell's palsy occurs due to paralysis of 7th cranial nerve. Purification of water by chlorination. Next, which is known as poor man's meat. Pulses are known as poor man's meat. Complete food is milk. Safest animal food, that is fish. Increasing the amount of high density lipoprotein had no side effect on the body. Weight loss in neonate during the first week after their birth, that is 18%. Part of water in human body is 2/3. Vitamin A deficiency cause xerophthalmia. Anti-cancerous alkaline is present in stomach. Commonest site of keloid, sternum. Normal value of indirect bilirubin, that is 0.2 to 0.8 mg per deciliter. Threshold of kidney at which sugar appears in urine, 180 mg per dl. Nature of hepatic bile, it is alkaline in nature. T-wave inversion is seen in myocardial infarction, that is MI. Next, poliovirus acts on LMN, that is lower motor neuron. Pulsus sarcoidonicus is seen in tetanus. TAP vaccine is used in typhoid. Tychobia found in female. Length of 1 year baby, that is approximately 75 cm. Length of ovary 4 cm. Coplic spot seen in measles. Airborne disease smallpox. Vector of sleeping sickness fly. Vidal test positive comes positive after second week or during the second week Vidal test comes positive. Symbol of Cinnabar, it is HGS. Pulmonary hypertrophy is seen in left ventricular hypertrophy. Next is main cause of anemia in children. It is hookworm. Rickets in children occurs due to deficiency of calcium. Antimicrobial agent extract from shigru, that is pterigospermum. Longitudinal fissures are seen in syphilis. Frequent complication of measles, it is otitis media. Psoriasis is a non-infective disease. It is a skin disease and it is non-infective disease. Next, SWAS sign present in acute cholecystitis. Next, diabetic foot is an example of dry gangrene. Next, codeine is derived from opium. Cells of pancreas which secrete glycogen, that is alpha cells. Wrist drop occurs due to radial nerve. Bodybuilding material, protein. Protodiastolic period in cardiac cycle is of 0.04 second. Spring ligament, also known as plantar calcaneonavicular. Route of BCG, it is intradermal. Dose of amylyl nitrate, it is 0.5 to 0.7 ml. Amlodipine is given in hypertension. Poodle sign is seen in ascites. Thank you.